Hi everyone. My name is Dr. Kaushik Sarkar. I'm the Interim Country Director of an international non-profit, Malaria No More. Starting October, I would be leading our Global Center for Malaria and Climate Solutions as the Scientific Director and Chief Innovation Officer at Malaria No More. I'm a community medicine professional by training, and my work focuses on the field of digital transformation, innovations, and application of artificial intelligence in global health. Community medicine is a special branch of medicine that looks at the population at large, in contrary to the individualistic care focused under internal medicine. The scope of work in this discipline is diverse, essentially because of the interdisciplinarity of the subject. Individuals trained in this subject can choose to work in various niche areas, which include but are not limited to policy and advocacy, health security, public health practice, program implementation, strategy and partnerships, research, innovations, and teaching. One can even choose to work in overlapping areas depending on his or her experiences across different domains. I started my journey as a program monitor, gradually indulging in program strategies, planning, and implementation. While working in that space, I got exposure to digital health, health analytics, implementation research, and various other related areas. The experience gave me the opportunity to quickly move into a technical position, which includes research, program implementation, planning, etc. But it also gave me the opportunity to engage in policy advocacy, communications, and eventually innovations. The key to succeed in this domain is a combination of three elements. One, continuous upskilling towards a specific direction. Two, working in the field and working hard. And three, building a strong network of peers and seniors, and also with the professionals in other disciplines. Since community medicine does not have any specific specialization opportunity, unlike medicine and surgery, one must find the cross-disciplinary skills to be able to move up the ladder. For example, you can become a digital health specialist if you build your skills and gain experience in health analytics, health informatics, and in other quantitative areas. Similarly, advancing the degree and skills in epidemiology can enable one to move in health security, health intelligence, and similar domains. One can even move to for-profit sector if he develops cross-cutting credentials in management and/or business. Secondly, I talked about working in the field. So the bedside clinic for a community medicine specialist is field practice. A community medicine specialist must start his or her career working at the field level. The level of exposure can vary, but understanding the community environment in which they live and the system that provides them the services are essential to excel in any role. The networking also varies as one continues to gain experience and move up the ladder. But it is essential to have relevant peer network who can support in providing exposure, opportunities, or knowledge at the least. There are various industries that recruit community medicine or broadly public health experts. It can include public sector like health programs as program manager, monitor, in hospitals as managers, infection and hospital safety practitioners, or even preventive medicine practitioners, pharma in research, health projects, real-world evidence, donors in strategy and business roles, technology organizations as health technology experts, and others apart from teaching industry. Staying in one industry and diversifying experiences have both their pros and cons. But one thing is important, gaining a unique expertise in a specific niche. The niche is for what you want to be known for, and it can be a disease thought leadership, an application, a skill set, or even a subject area. I always recommend 3 I's to build community medicine career. 1, interdisciplinarity. 2, integration. And 3, innovation. There are opportunities to apply these three in any domain of work of community medicine. Interdisciplinarity is the application of multidisciplinary tools, techniques, etc. in your domain or discipline. For example, you can apply principles and methods of economics in public health measurement and monitoring. Integration is bringing synergy across strategy, business, portfolios, or even in implementation. It exists at every level. For example, you can integrate the functioning of analytics, monitoring, and program divisions. You can integrate research concepts, methods, applications, and can even translate interventions and experiments between domains or subject areas. Innovation is bringing a new idea in a particular field. It often requires design thinking and change management. So understanding design thinking and change management are essential. It can be a small change, as small as the routine movement of stock between different health facilities, or a big change like a policy change. But change is important in a way where the newness exists and applied efficiently and practically. I thank Dr. Archishman Mahapatra for this opportunity to provide it to me. And my final message is that no field in medicine gives you more opportunity to work than the field of community medicine. One must cash in with the scope of diversifying to be successful in this domain. Thank you.